Before we get into the New York law and its implications specifically, can you talk a little bit about NACDS and what work the association has been doing during the COVID-19 pandemic?
Absolutely. Well, NACDS, we represent, over thousands and thousands of stores across America. And actually there we have actually stores in every community, and Americans live within 5 miles of one of our stores. And we have been really working very hard and very diligently throughout this pandemic to ensure that the communities are able to stay healthy and be able to have the necessary treatments they need, whether we're talking about COVID directly or we're talking about chronic care for illnesses such as diabetes or hypertension. So we have been there every step of the way for our communities, and we couldn't thank our healthcare professionals and our teams. Can't even thank them enough. They've been such great heroes to being on the front line during the COVID pandemic here.
Awesome. So once a COVID-19 vaccine becomes available, the new law will allow pharmacists to administer the vaccination. So what role have pharmacists been playing amid the pandemic, and why is this law significant for pharmacists and their patients?
Sure. So during the pandemic, we pharmacies have been out there and really trying to deliver and help on the preparedness on the testing side, having to do with COVID-19. And so going out and basically building and creating these drive-through testing opportunities. And there again, it's really to help minimize the spread of the disease throughout the communities and across the nation. When the vaccine becomes available and when it's approved by FDA or authorized by the Food and Drug Administration, it's going to help prevent the spread of disease. So we're going to be moving from more of a we've been very reactive, and now it's going to be more in the prevention side. And if we can actually ensure that we can get all those Americans vaccinated, we can really take down a lot of the unfortunate comorbidity issues that happen, whether people have diabetes or hypertension and heart attacks because of the flu and because of COVID. And so at the end of the day, this will be extremely important to foster and accelerate population health and community health.
So it makes sense that New York would pass this law since they became the state most acutely affected by COVID-19 and had the highest number of cases. Do you foresee other states taking up this law as well, or perhaps also a national approach that facilitates pharmacist-provided COVID-19 testing across the country?
Absolutely. So we've actually are going to be doing both in a parallel fashion, both at the federal level as well as the state level. Much like we did for the COVID testing, we worked with the administration and HHS and the secretary to get in the COVID testing area guidance issued that actually really helped preempt a lot of the state issues and barriers that were needlessly there, just unfortunately blocking testing from getting to, the consumers and the American people. At the same time, though, we also worked at the very beginning with all the states. And so between the two, we were able to really make a profound impact. We're carrying that same strategy forward in the vaccination world. Right now, we are working and talking, having discussions with the need for HHS and the White House to, again, issue another guidance under the PrEP Act to basically, again, ensure that all the needless barriers like age restrictions and the like can be removed so that, again, we can accelerate a rapid acceleration of vaccinations to everyone in the communities. And at the same time, we've also been working with the states. And so we've been talking about preparing now. We want to actually ensure that we can actually have a clear and free runway now. And it's an opportunity to actually remove all those unwarranted barriers so that when the vaccination does come, we can really accelerate again. So we're working on with the governors. A lot of actually folks are moving in the right direction, but clearly all good things, but more work is necessary to make sure that our nation is well prepared.
So the NACDS press release that announced this law also stressed the importance of keeping up to date with all vaccinations as the pandemic continues to affect Americans. How can pharmacists and pharmacy organizations make sure that their patients know to receive vaccinations when they also need to be social distancing and those measures are still in place?
Oh, that's a really good question. So many adults, as you mentioned, do not receive all the recommended vaccinations. And really what happens is that CDC has a sub-working group that actually says and sets forth when and who should get these vaccinations. And when you're looking at, and it's really made up of a body of medical experts, scientific, public health experts that provide these vaccinations to the population. But unfortunately, when you're looking at the adult population, it absolutely lags behind, the Healthy People 2020 goals that we have for flu, for pneumonia, for tetanus and diphtheria, even herpes zosters and others. And so when you're looking at those vaccination rates, we're sitting really, like you look at 2017 vaccination rates, so you're only 45% of the adults actually got their flu vaccine. And so, that really needs to really increase. And then when you look at pneumonia, you're talking about only less than 25% actually got their vaccinations for ages like 19 to 20. And then when we get into the older population, it gets a little higher. But again, more work is needed there to make sure that we educate the population. And then we also make sure that these are readily available. And our pharmacies stand ready across the country to to provide these vaccinations. CDC just issued a guidance just a few weeks ago, allowing vaccinations to now to recommence. As you know, with the COVID-19, CDC had put sort of a stop order, moratorium on vaccinations across the nation, and really, again, because of social distancing and trying to mitigate the spread of the disease. But now they realize that that with the social distancing, with PPE, that there's really a need to move back into this traditional and vaccination schedules and making sure that everyone gets their vaccinations. So I think that at the end of the day, pharmacies are readily accessible. They're in everyone's communities I mentioned. You don't have to go to the hospital or clinic to get there. We see across the country a fear of consumers going, to their hospitals and their clinics and their physician's office, but they still feel very comfortable though coming to our pharmacies. So it's absolutely unequivocal that we continue to get this education out there.
Kathleen Jaeger, thank you so much for joining me today.
Oh, it was my pleasure. Thank you so much.